look at treating patients with scoliosis, we know there are two major avenues. And one avenue, like what I like to call it, is the traditional approach to scoliosis. And very oftenly, the traditional approach to scoliosis is something like this. It's typically watch and wait until the curve becomes severe enough to consider surgery. The only patient that's actually treated are the patients that are going through rapid pubescent growth spurts, and they're normally treated with something called a Boston brace, just trying to slow down progression during the growth phase. None of the courses are trying to manage or reduce the curve before it becomes surgical. In no cases are they treating curves in the adult stage to try to reduce them. They're normally just treating the symptoms and dealing with the effects of the curves as it becomes bigger and bigger and bigger. Where our approach, or more conservative approaches, are now trying to actually reduce the size of curve in both stages, in adolescent and in adult form. And that is really to mitigate the risk of progression, because there's one thing that is true, is that as curves get bigger, they're more likely to get bigger. So therefore, the way you influence the risk of progression is by trying to reduce the size. If you make curves smaller, they're less likely to progress in every phase of life, because we know as the curve gets bigger, it's definitely more likely to progress.